Patient on this woman was 58-year-old when she saw me in Singapore, clearly postmenopausal in April of 2015. She took about a day and a half to fly to see us every time she need to come. So she took 1.5 days, came over and saw us at that time. She presented to the orthopedic surgeon because she couldn't walk and she lost weight. And when they take the x-ray and half of the knee was eaten up, and further examination found that this lady has metastatic disease in the proximal part of the right knee, leading her to be wheelchair bound. Clinical examination, so bilateral fungating breast mass, bilateral axillary lymph node, supercleft lymph node, lung, and CT scan show disease in the lung and the mediastinum. And there are multiple spinal metastases and the sacral metastasis. The question is, why was she hiding it? The answer is that her husband was very sick, so she spent her time looking after the husband. Husband passed on. She went into depression and eventually found by the children that she was harboring this problem. What's amazing is that she has an MRI of the head done because she has some weakness here and there, and found that the tumor was mainly in the pituitary fossa arising from the clivus. It was a form of bone metastasis eroding onto the pituitary gland, leading to some form of pituitary dysfunction. And there was a tumor onto the sphenoidal and cavernous sinus. And what's frightening is that these actually encasing the cavernous part of the left carotid artery. And there was also bony occipital bone in the skull compressing onto the dura. There was, however, no definite brain parenchymal disease. So when I first saw this lady on wheelchair with this and living take about 1.5 days to come to see me, I thought that she was going to die soon, so we probably shouldn't do very much. So that was what we were planning to do at that time. So next slide. Oh, I control or somebody control for me. Okay, yeah. So we did a bilateral breast biopsy. She was ER 90% and PR was negative, HER2 negative, clearly a luminal B breast cancer on both breasts. No family history. She had history of hypothyroidectomy, hypothyroid on replacement, and THBSO done for uterine fibroid a few years ago. And at that time, sorry, not quite yet, back please. And at that time, the treatment that we are giving to her was a whole brain radiation because of the tumor in the brain, and radiating her knee so that the pain will be better. But as I mentioned, she wanted to go home. She basically was depressed. She said, I want to go home. I don't want to do anything. And you take her about 1.5 days to come to see us. So I think during that time, the SWOG data was out using combined hormonal therapy and maybe better than solo agent. At that time, CDK4/6 was not quite available. So she was started on anastrozole and the fulvestrant as based on the study reported by the SWOG data. Okay, next one. Do I control here? Yeah. Okay. Now she didn't do that well. It's about 6 months later, she flew back again because she was breathless. I thought she has pulmonary embolism. And on CT scan suggests that she has bilateral pleural effusion and also new lung metastasis. Brain disease continued to be stable. So we drained her effusion, make her a bit better. We told her that she needs to be on chemotherapy. Once again, she said it took me 1.5 days to come to see you. So the chemo I gave it to her is an oral chemotherapy for which she is able to go home and manage there. And to be very fair, I really thought that she won't live very long because of the stage of disease. So basically quality of life, I'm managing her. So give her a combination of capecitabine and vinorelbine. She did better than I expected. Next one. Now you can see she was on this disease on remote control. Come and see me once every 4 to 6 months, maybe 4 months, and continue to be stable and come back nearly about 2 years later on the above chemotherapy, showing evidence of disease progression in the skin and the lymph node. Now during that time, CDK4/6 was made available and she was started on Ibrance. I messed myself up. My first line, I gave her Arimidex and anastrozole and fulvestrant, so I don't have much options of AI, so I put her on aromasin. Now she responded reasonably well on this regimen for maybe about 1.5 years. Okay, and showing in sometime last year, her disease progressed again. I did a blood biopsy on her and proved that she is PIK3CA E545K noted. All right, now while waiting for the aliprosectomy made available, apply for her, and I still need to treat her, and she need to go home. So I gave her the Bolaro-2 data using everolimus and give her Afinitor. And once again, I told you that I've given her all the options, right? So the only one left behind it, I give her letrozole, and she went home. And that was sometime in February. Now she remained quite stable on this regimen for about 6 months. And then she came back in August of last year. And at that time, she continued the progression, but the progression is relatively slow, mainly in the lymph node, mainly in the skin. She is quite comfortable. In fact, she was walking. She's been walking for the past probably 2 years after the radiation. And when the drug was made available, because they show some form of progression, she was changed to alpelisib, a 300 milligram full dose with fulvestrant, giving her all the horrible possibility, asked her to take her sugar, buy the hypocount machine. I must admit that she beat all the odds about all the zero side effect from the drug. She doesn't have hyperglycemia. She does not have diarrhea. She did not have rashes. She actually sailed through it. And she came back about 4 months later. As I say, she took me about 2 days to come. So every time is this remote control telephone consult. And I think that her disease is quite stable. I think that she has some minor progression. I say that you're not doing so well. Maybe you should go on to chemotherapy. Absolutely refused to say that I'm not going to go on chemo. I want to go home. So she returned to Indonesia on the same treatment. And from there, because of the COVID, she couldn't come over. So every time it's teleconsult talking to her, she still tolerates the treatment, very, very joyful about the fact that she's doing well. She got her fulvestrant from Indonesia. Novartis kindly giving her free alpelisib and sending to her home country. And the son called in sometime in end of July to say the mom fell down and she died. Now from diagnosis with the extensive disease to the time she died, she lived 5 years and 3 months. Irrespective of all I see is it's a bit of combination of, well, we can criticize whatever way, didn't give her chemotherapy, the sequence is not optimal, and it demonstrated sometimes irrespective of the not so bad treatment, I think she lived very, very long, for 5 over years. So this is one of I call it a relatively successful case of alpelisib, because I need to present a case on this, and my rest are not so optimistic. So sorry I have to put up this case, but I think it's quite interesting to see somebody who lived so long, irrespective of the extent of the disease.